So you're not tired because you're lazy, and you're not foggy because you're getting older, and you're definitely not broken. If you have Hashimoto's and you are still exhausted despite the doctor telling you your labs are normal, this is most likely going to explain why this is happening. Because Hashimoto's is not a thyroid disease, and I know that might surprise a lot of you, but treating it like a thyroid disease is why so many high-functioning, intelligent, driven women stay stuck, exhausted, inflamed, anxious, and foggy, quietly wondering if this is just how they are going to live day in and day out. Now, let me say something very clearly. The thyroid is not the criminal. It is the crime scene. And if you treat the crime scene but ignore the criminal, the unfortunate truth is you're going to stay sick. Every week I see the same exact pattern. People come in and they say they wake up tired, not a little bit tired, but literally metabolically drained. You need caffeine just to feel human. You lose words mid-sentence. You reread the same paragraph 3 times in a row. Your hair is thinner, your skin is drier, your weight feels hormonally resistant, your cycles have changed, your anxiety feels unfamiliar. Realistically, you just don't feel like yourself. So you go to your doctor and you get your labs done. A lot of times they'll just draw a TSH and lo and behold, it's normal. Visit over. No one asks why your immune system is attacking your thyroid. No one asks what changed years before your diagnosis. No one asks why are your antibodies still elevated. You're given a drug, usually levothyroxine, and you're told, well, we'll see you in 6 months. For some people, that works. But for many, it doesn't remove the needle at all. You're still feeling like garbage. Not because you're dramatic, but because the model is incomplete. Here's what nobody told you when you were first diagnosed with Hashimoto's. You don't have a thyroid problem. What you have is an immune tolerance problem. Hashimoto's is an autoimmune disease. It means your immune system is attacking your thyroid tissue. The thyroid is the victim. When your immune system loses the ability to distinguish self from threat, it begins attacking thyroid tissue. When you replace thyroid hormone, you may correct the lab value, but what it doesn't do is it doesn't retrain the immune system, and that is what you want to go after. And that is the distinction that really does change everything. So let's go one layer deeper. TSH is not a thyroid hormone. It's a signal from your brain. That's what everybody looks at. Your thyroid mostly produces a hormone called T4. T4, which is what levothyroxine is largely an inactive hormone. It has to get converted to T3 to become metabolically active. That conversion happens throughout your body. It's in your liver, happens in your brain, your muscle, and it depends on enzymes that are extremely sensitive to inflammation. So when inflammatory cytokines are elevated, conversion slows. Reverse T3 increases and your metabolism hits the brakes. You can have a normal TSH and normal free T4 and still have very poor thyroid signaling. Your hormone can be floating around in your bloodstream, but if inflammation alters receptor sensitivity, your cells don't respond appropriately. This is why some people with normal labs still feel completely awful. Normal labs do not equate restored physiology. Guidelines are built for populations, and you have to understand you are not a population, you are an individual. Now, let me tell you something that I've seen in my clinic. I've had high-performing executives sit in my office and say, I feel like I'm losing my edge. I've had mothers tell me they don't recognize themselves anymore. They feel 10, 15, 20 years older all of a sudden. These aren't weak people. These are high capacity people whose physiology is stuck in a survival state. And survival mode suppresses optimal thyroid signaling, which brings us to something really critical. Autoimmunity is not random. I have never ever seen in my career an immune system that just wakes up one day and randomly attacks the thyroid. Autoimmune disease is cumulative, layer by layer. Chronic stress, sleep deprivation, gut barrier dysfunction, viral exposures, environmental toxic load, micronutrient depletion, hormonal shifts. Each one nudges immune tolerance downward until one day the threshold breaks. And instead of asking, why is my thyroid failing? The better question then becomes, what trained my immune system to attack my thyroid in the first place? So stay with me here because this is where it all shifts. Did you know that about 70% of your immune system actually resides in your gut? The gut is not just about digestion. It also plays a huge role in immune education. It's the immune education headquarters. Your intestinal lining is one cell thick. That's it, just one cell. One cell separating your immune system from trillions of microbes and food antigens. When permeability increases, which is what people call leaky gut, immune exposure also increases. Inflammatory signaling increases and tolerance declines. Microbiome diversity influences T regulatory cells, the very cells responsible for preventing autoimmune misfires. Short-chain fatty acids like butyrate help promote immune tolerance. And when that ecosystem is disrupted, inflammation rises. This isn't about trendy elimination diets. It's about immune calibration. Now let's talk about why this hits women so hard. Autoimmune disease disproportionately affects women. You probably already know that. Estrogen stimulates antibody production. Progesterone promotes immune tolerance. When progesterone declines, especially in perimenopause, immune balance shifts. Add poor sleep, chronic stress, metabolic strain, and resilience declines. Thyroid dysfunction also slows estrogen clearance, which amplifies the whole problem. Hormones are not separate from Hashimoto's. They are woven into it. And then there's stress physiology. Chronic cortisol elevation, what it does is it suppresses your TSH. It impairs T4 to T3 conversion. It increases reverse T3 and it alters receptor sensitivity. Reverse T3 is protective during acute stress, but chronic stress keeps your body in survival mode. And your body cannot prioritize high output metabolism while it is perceiving a threat. This is why so many patients say, I feel wired and exhausted, or I'm wired and tired. That is not a weakness. That is neuroendocrine dysregulation. You cannot out-supplement a survival mode. And then there's environmental signal distortion. Think of the thyroid physiology as an orchestra, okay? So hormones are the instruments, receptors, the thyroid receptors are the musicians, and then all of these cytokines that are floating around are the conductor. Environmental toxins are static in the sound system. The music keeps playing, but it loses precision. Autoimmunity thrives in imprecision. Hashimoto's is not one lab value. It is a network disorder involving immune signaling, stress physiology, hormonal interplay, gut integrity, nutrient status, environmental load, and so much more. Pull one string and the knot tightens somewhere else. Untangling it requires systems thinking. So if you've been told that everything is normal while your quality of life is continuing to decline, if you've started questioning your resilience, your intelligence, your identity, hear me clearly. You are not broken. Your physiology is responding to layered stress and immune misdirection. Hashimoto's is not your identity. It is a signal. If you only chase your TSH, you will survive. But if you retrain your immune tolerance, you can actually thrive. In the next video, I'm going to break down what this actually looks like. We're going to talk about the nutrient layers. We're going to talk about nuances of the different hormones and medications that are prescribed, immune modulating strategies, and what precision recalibration truly looks like. Because survival isn't the goal, thriving is. Thanks for watching, guys. We'll see you at the next video.
Thank you so much for watching. If you'd like more videos that help you understand autoimmunity and functional medicine in a simple, practical way, be sure to visit our YouTube channel for more educational content designed just for you. You can also register for our free Knowledge Hub, where you'll receive exclusive updates, deeper insights on our topics, and the latest health information to support your journey. We're so grateful you're here. And don't forget to like this video and subscribe so you never miss an update. See you in the next video.